Well, let's jump right into it here this morning. This is really one of the most popular segments on our show here on Montana Talks. Dr. Scott Sears with St. Vincent Healthcare joins us every other Tuesday right here on Montana Talks. And Doc, great to have you back on. How's everybody holding up here over the past 2 weeks at the hospital?
Yeah, really well. I mean, I think that we've been fortunate that we have a great group who has remained committed to patients. You know, I think so many people kind of put lives on hold with this coronavirus. And yet at the hospital and in our clinics, we certainly haven't put life on hold. I mean, although a good chunk of our time and effort revolves around COVID, there are so many other medical conditions that people are struggling with that, in addition to what you talked about the economy, people are staying home in spite of having chest pain or stroke-like symptoms. And that this fear of the virus has gotten so big that sometimes people are neglecting other conditions that are just as or even more serious. And so we take a lot of pride in making sure that we're ready and available and have created a safe environment for people to come in and continue to seek care for what they need.
Well, and it's interesting, too, because not only are you're at St. Vincent Healthcare in Billings, but you've also got clinics and operations in Bozeman and Lewistown, elsewhere across the region. But then you're a part of the broader SCL Health with hospitals in Miles City and Butte and elsewhere. And so I guess what's it just been like across the system? Pretty much same story?
Yeah, I think there are pockets. I mean, our system, of course, expands across Colorado as well. And in the Denver market, people are aware that Colorado was hit really hard with COVID, particularly in the ski resort counties. Here in Montana, our hospitals work really in a unified way. Our leadership team works collaboratively across the system, and it's been very similar. All of the standard protocols that we put in place are the same at every single clinic. So whether you're walking into a clinic in Cody, Wyoming, or Red Lodge, Montana, or Butte, Montana, the same thing is happening. I think our patients realize that as they walk through the door, they're immediately screened with a temperature, they're given a mask. If they have any symptoms, they're taken directly to a room and isolated. People are spending minimal amount of times in waiting room. I actually think there's never been a safer time, actually, to come to any of our clinics because of how much diligence people are paying attention to this.
Nancy in Roundup, did you have a question for Dr. Sears?
Yes, Dr. Sears, good morning, and thank you for being on the program. I want to talk a little bit about Dr. Robert Gallo, Gallo. He, of course, is the American biomedical researcher that co-founded the HIV virus find, and he started to talk openly about this Wuhan virus several months ago. And, his scientific information is ranked as third in the world, and he is being censored. I kind of want to know why this man is being censored. And I don't mean this next statement to be humorous in any way at all. But right now we have 1,700 doctors in the world, including the United States, and one in Australia named Dr. Andy Tagg, T-A-G-G, and people can find this out for themselves.
And Nancy, what does Dr. Gallo contend? What's his main contention that you think he's being censored for? If you can just share that.
I think he knows more about this Wuhan virus. I'm going to come right out and say it. I think that we're looking more at not at a virus, but more at a world authority takeover. We're seeing people like Dr. Fauci using computer models, and the information he's getting from this to turn our world upside down has been baseless. There's no facts to it, and we're seeing globalists like Bill Gates coming into the...
All right. Well, we just got to hold it there because we only have a brief amount of time with the doctor this morning. But Nancy, greatly appreciate your thoughts this morning, and we're taking your calls as well. 406-294-0970. Dr. Sears, are you familiar with this, Dr. Gallo? I did pull up an NBC News story about immunity from COVID-19 antibodies not certain, and it looks like they did an interview with Dr. Robert Gallo, who co-discovered HIV. But anyway, your thoughts on any of that?
Yeah, I think the whole COVID pandemic has brought to light a lot of issues that showed how ill-prepared we were as a country and as a global society for pandemics in general, right? Things have changed in the last 10 years, not, much less the last 100 years, and we're much more of a global society. I think individual countries have prepared and governmental agencies have kind of reserved the right to make decisions. And what you've seen, especially with this administration, is kind of a little bit more collaboration between the public sector and the government and the private sector and individual labs. And when you talk about individual researchers versus CDC researchers, there are a lot of great, knowledgeable people at academic institutions doing tremendous amounts of research that have always been held out a little bit different than, for example, an expert at the CDC. And I think what we're learning in this pandemic is that CDC folks and private sector folks and people from within and outside our country all have a lot to contribute. And we're learning a lot, not just about the virus, but how to interact with one another and share information in a way that leads to the best and most rapid solutions. And so I think there's a lot of progress, but clearly this is a new thing for people, and there is a lot of learning. And how do you get information from folks, and how do you make sure that's reliable information and share it? There is still a lot of that learning going on.
With about a minute or so before our next quick break, antibody testing. I know there's a lot of studies being done. What is antibody testing from your perspective, and how important is it? What do we learn from this antibody testing?
Yeah, great questions. Antibody testing is really important because we've talked on this show that if you can show that most people in a society are immune to a condition, you can definitely relax a lot of social distancing and other precautions that have been in place. The problem with the antibody testing right now on this COVID virus is a lot of the antibody testing is picking up what we call false positives, which means COVID is just one of many different coronaviruses. And if you've had any of the coronaviruses, which are very common in the winter, you may actually show up positive on an antibody test, think that you're immune to COVID, and actually not be immune at all. The test is just showing that you were exposed and now immune to another coronavirus. So there is rapid research being done to try and figure out an appropriate antibody test that gives very specific results for COVID itself, and not just generic coronaviruses. And that's why you see a lot of research, a lot of press about it, but not a lot of data yet.
A couple of questions I've got for Dr. Scott Sears. One is, we heard just a couple of weeks ago that these models that forecasted Montana hospitals being overwhelmed by the coronavirus, that the models were updated saying, hey, we no longer expect the hospitals in Montana to be overwhelmed by the severe coronavirus patients. And so that was a couple weeks ago, and now it's 2 weeks later. Doc, is that basically holding true? That, we just saw Sunday, out of all the tests that were done on Sunday in Montana, not one new coronavirus case on Sunday. So is it pretty obvious that we have definitely flattened the curve and have moved, we've gotten over the hump?
Yeah, we've talked about that a lot, that the goal has always been to flatten the curve, not to avoid this in general. If you flatten the curve, then you avoid so many people being in the hospital at the same time that it overwhelms the hospital system. And very early on, we knew that we were positioned really well. We had adequate equipment, we had adequate beds, we had adequate staff. But what was unknown was, how quickly could this spread across Montana? How many people would travel into the state and bring it with them and then spread it? And the only way you can get that data is by actually watching it day to day and watching what those numbers do. And so, yeah, it is a little bit higher predicted than it was 2 weeks ago. 2 weeks ago was probably the lowest point of the predicted model, but the models really show that if we continue to practice reasonable social distancing, phased reopening, that we should be able to handle any sort of secondary surge. But people shouldn't be deceived that this virus is going to go away. Just because there is no case on one day, this virus is going to be here, and it's going to be here going forward, and we just need to learn how to deal with it like we have all these other viruses that already circulate every single winter.
Yeah, and because it could come around again in the fall, kind of like some of what we've heard is that maybe even like the Spanish flu going back 100 years ago, there was a second wave. There very well could be other waves, and so we have to continue to be smart about how we do things. So just because we were, even under President Trump's phase 1 opening up America again plan, it still calls for some social distancing and minimizing non-essential travel and things like that. From the hospital's perspective, how soon can things get back? I would say, when can the hospitals open back up? But they never really closed. They did online appointments. You guys were doing online appointments and things like that. It's really about when can we get closer to normal and do those elective surgeries and things like that again?
Yeah, and I think this is a really important question. Elective surgeries, I love the analogy of holding your breath underwater, because people hear the term elective surgery and they think of things like plastic surgery, like I'm just doing this to look better. Yeah. Elective surgeries aren't not essential. Like these surgeries, people desperately need these. These are people who can't walk because their hip has horrible arthritis or their knee has horrible arthritis. These are folks who have been suffering in pain because they have an abdominal mass. And elective just means it's not even an emergency. Like you don't have to do it today or the person dies. But if you postpone these things too long, just like swimming underwater, eventually you run out of breath and you're going to drown. And these folks need these surgeries, and hospitals need to be ready. So we have already taken action to be prepared to open as soon as, our government is able to, give basically permission or endorsement and support of hospitals reopening to elective surgeries. The most important factors to reopen is you have to be able to very rapidly test for and detect COVID virus. And you have to have the resources and capacity to effectively treat it and isolate people who have it. And that's true community-wide. Right now at our hospital, we have a quick turnaround test. We've been getting test results within 24 to 48 hours. Really within a week, we'll have the rapid turnaround testing where we can really quickly detect whether or not someone has COVID. So if you're coming in for surgery, Aaron, and you have a hip being replaced this Friday, we will test you on Wednesday for COVID, whether or not you have symptoms.
Interesting.
If you have COVID, your surgery will be postponed and we will effectively treat you and isolate you. If you don't have COVID, we will be able to go forward with that surgery because we have adequate masks and equipment, we have adequate beds, we have adequate ventilators, and we have adequate staff. And we have protocols in place to protect people. And so we have been ramping up, getting ready for that so that when the time comes, we're ready. What we don't want to have happen is to say, okay, now you can resume elective surgeries, and now we have to plan for 3 more weeks to get ready. We're ready with all those things in place when we're given the go-ahead.
And that kind of sounds like what some of the schools are saying here, like the Bozeman schools, for example, saying, hey, prom, graduation, will we get back in school? It's really in large part, basically, it seems like people don't want to jump in until the government basically, the state government, et cetera, says that, okay, it's okay to jump now because nobody wants to be held liable is almost like what it sounds.
Well, liable, and nobody wants to be responsible for gathering large groups of people and unintentionally causing a secondary surge. If you bring 2,000 kids together in a high school, you are going to cause a secondary surge because you're bringing people from all over, then they're sharing, and then they're going back out into the community. However, if you're bringing people in with appropriate social distancing, appropriate screening, rapid turnaround testing, isolating them as quickly as possible, you can actually control the spread of this and treat people appropriately. Some of the public policies that have to be changed, though, is folks have to quit sending their kids to school when they're sick. If people reopen school right now, I guarantee a lot of families are still sending kids to school with runny noses and sneezing and coughing.
Because they're just ready to get the kids out of the house.
They are. Or people fear like I have to go to work even though I'm sick, and we have to do better. People who are sick shouldn't be going to work. People who have sick kids shouldn't be sending their kids to school. And that behavior has to change. That has to change.
Yeah.
Right? The new
and
normal
employers
has to be people keeping them home.
And employers got to be more cognizant, as I hope they will as well. All right, we got callers on the line here as we chat with Dr. Scott Sears from St. Vincent Healthcare. Brenda in Billings, did you have a quick question or comment?
Oh, yeah. First of all, thank you, Dr. Sears, for being so well-versed on everything. The other thing is, Governor Bullock has a huge responsibility. A lot of us are ready to go on to phase 1 now. Does he confer with you and other physicians for recommendations?
All right. Thanks, Brenda. Good to hear from you. Dr. Sears, yeah. Have you chatted with the governor at all?
Yeah, not directly. I will tell you that the governor does receive input from physician leaders from around the state, particularly the Montana Hospital Association, which is made up of a lot of physician and non-physician healthcare leaders who are able to give input around this is what we're seeing, this is how prepared we are, this is what to watch out for. And he does consider that. I think one of the tough spots the governor is in, obviously, is when you make public policy or public decisions that are public health decisions, you rely on the residents of your state to comply with what the recommendations are, and making sure that there's been enough evidence that people are continuing to practice those things that have been shown to be important gives a lot more confidence. For him to hear that his hospitals in his state have quick turnaround testing and adequate supplies and adequate beds and staff, then can give him the confidence, okay, we can help control this, so I'll make this decision. So
yeah, well, and I know we read reports that hospitals were losing $100 million a month, roughly, from the coronavirus, according to the Montana Hospital Association, the news out of Kalispell. You saw that with 600 being furloughed there, but I did speak with their chief medical officer. They're hoping to get most of the folks back to work once they get back up and running closer to normal here soon. Let's see, next up on the phone lines, just a few minutes to go here with Dr. Scott Sears. Tim in Columbia Falls, did you have a quick question?
Well, I didn't really have a question. I just wanted to reiterate, going back to, I believe it was Nancy from Roundup. I didn't understand the answer, or I don't know if she got an answer from the doctor in regards to, her question and Bill Gates and things like that. And I guess I didn't get a clear answer on. So
the question that you want answered from, because if I'm summarizing it, it is the medical community basically being silenced? Are we not getting a full open debate? Would that be a good summary of the question?
I would say it'd be pretty close, yeah.
Okay, great. All right, well, let's go back to Dr. Sears. Yeah, Dr. Sears, I guess more specific. Is there a full, vibrant debate on the coronavirus? Because it does seem like in the national media in particular, it's like, oh, you can't talk about hydroxychloroquine. And it seems like we've walled off an open debate on a lot of this stuff.
Yeah, I think part of the reason that perception exists is because the news conferences basically show the White House task force every day in the afternoon getting up there and sharing what their opinion is. So you see Fauci, and basically he becomes the head of what information is shared. But what people don't see, because it's not broadcast on the news channels, is that every community has a unified health command. So here in Billings, for example, I can tell you there's Riverstone Health, there's Billings Clinic Hospital, and there's St. Vincent Hospital. And leaders and physicians from all three hospitals sit together. And if you sat in one of those rooms behind closed doors, you would hear a very healthy debate, very different opinions. And by being able to challenge one another, we come to conclusions that take into account the best interest of the hospital, the patients, and the staff and the community. And so the banter is very healthy. The problem is they just don't broadcast that on national TV. So people are left wondering, are there debates and discussions going on? And I can guarantee people that there are, even down to the community and even hospital level.
Well, I know we're out of time, but I know Brad Molnar was going to have a question about, why are we still calling a pandemic? It's not even an epidemic based on the numbers that we're seeing right now. So I wish we had more time, but I know you got to run, and we've got another guest coming up right after this. But Dr. Sears, is it safe to say that the hospital staff and nurses and everybody, they're ready to get back to work also here? They're ready to do these elective surgeries, everything else?
Absolutely. I mean, I think the staff, everybody is committed to taking care of patients, and they feel a little bit hamstrung lately on their ability to take care of patients for all their conditions, and they're ready to get back to that.